An exclusive Live at 7 investigation has revealed that private nursing homes are engaging in the dangerous practice of reusing needles on their insulin-dependent residents that should be disposed of after a single use. During a 3-week-long investigation that involved visits to several private nursing homes in the corporate area and Portmore, the Live at 7 team discovered that there are homes that will use one disposable needle for an entire week to administer insulin doses to their diabetic residents. Practical nurse at the B&D Assisting Living Nursing Home tells our undercover reporter that one disposable needle can be used for up to 7 days. I asked her if we can use one per week or 2 weeks and see. One second. Wait, the nurse only?
Maybe it is one needle for the week, not for 2 weeks.
Not for 2 weeks, but one for the week.
Yeah.
At another nursing home in Portmore, St. Catherine, Pleasant Care, the owner tells our news team that a registered nurse advises the home on the total number of times a disposable needle can be reused.
Okay, the family is responsible for the doctor, pampers, and medication.
And by medication, you mean the insulin. So what about the sharps? For the injection.
What I'm saying?
You provide that with the hospital?
For that.
No. Family responsible.
If once you are responsible for the insulin, it comes. The insulin has to come with sharps.
Okay. So would we need to provide one for every day? How do we do it?
Well, if you want, you can provide one for every day, which is very expensive. But we use one like for two because it's them alone using it. Twice. In the hospital they use one because we don't actually know who is wrong, what is what. But I have a lady, her daughter is an RN at emergency. KPH and my RN is from Spanish Town, so we are guided by them. If they cannot buy for every day, they'll ask us to use 3 times. They tell us how
three times.
They will not necessarily 3 times. They'll tell us
how often they can reuse. On another visit to that home, a practical nurse showed the undercover reporter how the stale needles are stored to ensure that the patient isn't infected when it's reused over and over again. The needle is kept in an open plastic container stored in the fridge door. That's it. That's it's not put in a...
When we're going to use it, we use the alcohol and clean properly.
So you don't put it in like a Ziploc bag?
No, this person, she's not here. So we normally...
Can I see the container? Is it left open? I mean, that's what...
No, this is not using no. Normally when we have them, we put them in a liquid.
No, I just want to see the container. Oh, so you leave the insulin in the... This is the insulin, right?
Yeah.
And so what would you do to this now?
We clean the alcohol swab. Properly.
You'd swab where? This area here?
The middle, before we use.
Alright. And then you get the insulin from here. So isn't it safer to put it like in a Ziploc bag?
We do, but it's just the one person is using it. It's not, we don't have a group of people here who use the needle. Just one person has.
Right. So and she told me like one could go for like a few days.
Yes, that's the same person.
Alright. A number, like a week? Could it be used for a week?
No,
and then you replace
don't use it for a week. Like just 3 days.
Like 3 days. Alright, cool. Here, a practical nurse explains that sometimes the used needles are stored in Ziploc bags to prevent contamination. When confronted by our Live at 7 team, the homes engaging in the dangerous practice sought to justify their actions. Yes. Remember I came here?
Yeah, but as I said before, I told you that the relatives say they can't hardly afford it. Sometimes they just give us a few, but I have come to the show.
No man, that's not the issue. The fact is that you do reuse it on your patient.
One person we have.
You reuse it on the patient or patients that you have. We're told over the years, it's a practice
it's
here.
Only one person we have that take.
Do you know that I sat with the Ministry of Health, the CMO, and he says this should not happen under any circumstance whatsoever. What do you have to say about that?
I don't know, just that the relatives ask us to use it. They can't afford anything else. So.
But do you know that that's dangerous?
But that is for you to tell me. Are they to tell? They have.
So the ministry has not informed you of this?
No, not that I know of. But the parent, what you need to do is the relatives, when they ask us what we're going to do, I can't buy for them. Is the relatives one person we have taking insulin, and they ask us to do it. Two times. We use one needle, probably twice.
And the relatives are supposed to pay for these needles?
They have to buy medication, insulin. They have to buy it.
So they are at fault for what's happening as well?
They ask us to do it. They ask us to do it. What can we do? We have other things to deal with. If you know that some of them leave their family members, they're not paying for them. I have to still go out there. I'm just coming from drug serve trying to get some medication for a lady.
We're just doing our jobs here, right?
I know that, but I'm just doing my job.
It's not personal, we're just doing our job.
No, but you came and that's on a false pretense. Don't do that. I'm here, I'm talking to you. You asked me about needles. Of course, I have something to do. You asked me about needles, and I'm telling you. Sometimes they don't provide needles.
What is the...
When they do, they ask us to use it because they don't have any money to pay. Some of them leave them people for months. It's becoming an epidemic now.
People are abandoning their relatives?
Their relatives, that's what they need to investigate.
Thank you very much for your time. I appreciate it.
They need to address the fact that they're abandoning their relatives.
And you're forced
without. No, I'm not forced. If it's a need you're talking about. What is wrong? They asked me to. It's one person. And they use the needle like maybe twice. That is the issue. That's the issue you have.
You don't consider it's dangerous reusing a needle, whether twice or 3 times?
We agree, yes, but there are other dangerous things out there.
Like what?
A lot of things. You and I know.
All right, thank you very much.
You are so welcome.
Thank you.
You are welcome.
Yeah, man, we appreciate the time.
But if it's just the needles we're talking about, we have other issues in nursing homes.
Tell us some of them. What are some of them?
And when, I think you want to employ any of the nurses here? Would you like to employ a nurse here?
What do you mean? I don't understand the question.
Eh?
I don't understand the
You
question.
want to employ me?
I don't understand the question.
Just a needle and you look at what is happening. I'm not afraid. I am not afraid.
We don't want you to be afraid.
Look at the ministry and talk about needle. It's one little old woman and our daughter said, we don't have nothing, we can't afford it.
You say one little old woman like she's not alive, a precious life.
Old lady. I wouldn't be in the business. I wouldn't be looking after them. Everybody's precious. That's why I'm working with them.
So what do you mean one little old woman? I don't get that.
One little old lady.
What does that mean?
No, I said it's one little old lady that uses
That's
insulin.
not the information that we have.
Ask them in there.
Prior to now, have you had other patients that
No,
use insulin?
one nurse. One lady that uses insulin in here. One. So wherever you get your thing from, check it out. But God bless you anyway.
Contrary to the claims being made by the owner, a practical nurse in training who worked at the Pleasant Care facility confirmed that the dangerous practice of reusing needles on the aged and defenseless residents has been condoned at the Portmore-based home for some time now.
Based on our guidelines that we got to work with, there are a lot of discrepancies in terms of care of patients, reusing of needles, in terms of patient deaths, patients, in terms of also the washing of the dishes. Dishes were washed in one container, rinsed in the other. When questioned, I was told it's for conservation purposes.
Tell me about the reusing of the needles.
Well, we were told that the needles were used on patients who are diabetic. So if that patient is diabetic, the needle wouldn't be thrown out, but it would be stored and reused on that patient.
How many days?
Well, as far as I'm not sure, but we have been there for a number of weeks and it's the same needle, so I guess up to 3 weeks. Before me, they had 2. So they had 2 needles reused, and they asked how they are sure that the correct needle has been used. They said they tagged the needle with the person's name on it and placed it in the relevant place, so they keep the using. I guess they store it in a refrigerator or, I'm not sure, but she said that they have a bag with the patient's name on it and they put the needle in there.
Over at B&D Assisting Living, our news team was told that the needles are being reused by doctor's orders.
I I don't
I cannot answer that. That's what the doctor told her.
That's what the doctor
Told her, yeah.
A doctor?
Yeah.
Where's that doctor from?
I cannot say right now.
Why is that?
Because that doctor doesn't come here anymore.
So did ministry inform you that that practice shouldn't be?
As I said, I couldn't answer those questions because I wasn't the person here at that time. I am not the owner here.
In any event, your establishment is breaching a ministry policy. It's very dangerous to reuse needles. Do you know this, or you are
No, but
trained?
you should say where you're from when you came. You weren't truthful. You weren't truthful with yourself.
Well, if I told you I was from CVM, I wouldn't find out what was happening.
No, but that wasn't truthful.
I wouldn't find out what was happening.
That wasn't truthful.
But that's besides the point, there, you know. Are you trained? Are you a trained nurse? Practical nurse?
I said I'm not going to answer you today because you are not from ministry.
So you'd speak to the ministry when they
Yeah,
come?
the ministry comes here because normally they come here.
Well, they'll be coming.
Yes, I'm expecting them anytime because they're supposed to come up from the 15th of December.
And they haven't?
No.
Re-register you?
Yeah,
So they're
and
late.
certain things that supposed to was to put in place, they were put in place, but they haven't returned since.
So the ministry is late?
Yes.
Is there anything else? Will you guys stop doing this, reusing the needles, because it's a dangerous practice?
Sir, I know you're happy on the microphone, but guess what? As I said to you before, it's not my place. So there's no way you could say that I told you that it was my place. It's not my place.
Well, look, that's besides the point. That's not really what we're contending, What we're contending is the fact that needles are being used on patients more than once. That's what we're talking about here, and that's a dangerous practice. The Ministry of Health's policy on the reuse of needles is crystal clear. It shouldn't happen.
Generally, needles and syringes are what we call disposable supplies, apart from some specialized ones that are used for specific procedures in the hospitals. Generally, needles and syringes are disposable and hence they're used once. Once the needle has entered the body, it is considered to be contaminated. It can have blood, it could have had infectious agents on that needle, and hence it is not usually reused. Unless the needle was to have been sterilized, and we have some special needles that are sterilized and reused in some special procedures. But generally the needles and syringes that you see are one-time use. One of the critical reasons for this is that if you use a needle on an individual and you are trying to secure that needle for reuse, you then have to recover the needle, and the attendant risk of accidentally sticking yourself comes up, and hence the risk of transmitting infections from the person who the needle was originally used on to yourself. So that is the main risk why needles are not reused. So the risk of transmitting HIV, which is very low, but hepatitis B, C, and other conditions are really what the critical things that are considered about the needle becoming like a vector, transferring the infection from the original person it is used on to accidentally the worker, or if it's used on somebody else. And if the needles are not stored properly, they could be contaminated, and you can get infection around the sites of injection use. So it is something that is definitely not recommended.
And I read something that suggested that reusing a needle can cause tissue damage.
Right, so the point of the needle as well, and particularly if they use the same needle to pull up the insulin and to administer it, which I hope they're not doing.
One needle.
Right, so if they're using that, then the tip of the needle can be blunted, and hence on the second or third use, then it produces more trauma to insert into the skin because it's now blunted, and hence you're at a higher risk of infections.
6 of the 8 nursing homes or Live at 17 visited said they wouldn't reuse the needles. The Health Ministry has confessed that staff constraints make it rather challenging to properly police the homes because they are spread across the island and some operators start offering services without informing the ministry. The Health Ministry also said that it is often difficult to identify these homes because they operate out of residences. According to the ministry, public health inspectors check the homes once per year and registration is done once every 2 years.